Hello everyone, my name is Dr. Joel Rosen. I am a thyroid recovery doctor right here in Boca Raton, Florida. And today I wanted to talk to you about a case study of a 55-year-old female who is dealing with thyroid problems. And I wanted to present this because if you're watching this video, then it means you've probably requested for some more information in regards to your own thyroid problem or someone in your family or loved one who is dealing with a thyroid problem and you wanted more information, or you searched on the internet and here you are watching this video. So my goal is to actually present to you a real live case that has come to our office and hasn't started any care with us, but has been already going to a doctor since 2006 when she started dealing with her thyroid problems. And since then she's been on Synthroid and Armour and she still doesn't feel great. And so what I do is I have her bring in her blood work. I have her fill out about 20 pages of information that discuss her past medical history, other symptoms she may be dealing with, stressors that were in her life, her dietary history, her upbringing, her childhood history, any antibiotics she went on, and any pathogens or infections or other type of problems she may be dealing with, so that we can troubleshoot exactly what may be causing her problem. And I really wanted to present to you her case because I think a lot of you are dealing with the same problem, except you never had the test that she had to find the problem out. So let's go through this case systematically. She came in with 6 major symptoms or major problems that she wants to be addressed. The first one is, she mentioned thyroid, so she has a thyroid problem, mainly thinning hair, and I see a lot of patients that have thinning hair, and that's a really tough thing for a woman to deal with. They're brushing their hair and it's coming out in clumps. They're in the shower and they see the hair in the drain, and that's just unacceptable. Low energy, so doesn't feel like doing things, crashes in the middle of the day. Her brain fog is impacting her work. She's still working and she needs to be sharp on the ball, and she's just not recalling the way she normally used to. Her memory is off. She has gastrointestinal problems, bloating, gas, constipation, and she has joint pains. So we talked about her family history. She's been on Synthroid and changed her Armour since 2006, and she went through a really stressful divorce back then, and she said on a stress scale she was about 20 out of 10, although she's not on that anymore. She just doesn't feel great. So what I wanted to do is I want to talk to you about her diet. She eats dairy, wheat, and other grains, although she does admit that she's trying to reduce those. She doesn't do a 100% effective job where she's eliminated it completely, but she does try to avoid those things. We have 2 sets of blood work that we reviewed. One's on April 4th of 2016 and one's of July 12th of 2016. Her TSH levels were 6.84. And that's high, which means it's a hypothyroid problem. When we have a underactive thyroid functioning, our brain says, hey, thyroid, you got to work a lot harder, and it releases more thyroid stimulating hormone. And so we can tell someone has a thyroid stimulating hormone that's elevated is a hypothyroid patient. Ideally, from a lab range, she should be between 0.27 to 4.2, so 0.2 to 4.2. From a healthy range, it's 1.8 to 4.0. So there's a big difference, and that's a big learning lesson. However, she was 6.84, which was even above the lab ranges. She did her retest again in July. They upped her medication, and she went down to 4.8. Still above where she should be, 4.2 from a lab range, but well above where she should be from a functional range. So even though the Synthroid and change to Armour had brought her TSH lower, it didn't fix the exact problem. However, they happen to do thyroid antibodies, which means her own immune system is attacking her thyroid, and she should be less than 34, and she was 65 in April. That means she's Hashimoto's. Rule number 1, if you have any thyroid antibodies, then you have Hashimoto's. However, she was never told she had Hashimoto's. On top of that, her Hashimoto antibodies went higher between April and July. So she was 65 in April and she was 88 in July. And I hardly ever see this because doctors will never run these tests, let alone successively from one test to the next. And number 2, they don't really care. They just want to put you on Synthroid. Synthroid did do a good job of bringing her down from 6.8 to 4.8, so it brought it down 2 points. But her antibodies went up higher. So why is that? Because something is stressing her immune system. Her blood sugar is elevated, her A1C is elevated, so she is insulin resistant. That's going to be very stressful for her immune system. She also eats dairy and gluten and soy and grains, and that's going to be very stressful for her immune system because we react to these particular peptide structures. Her thyroid antibodies were also elevated with her thyroid binding globulin. She was at 1.2 in April, shouldn't be above 0.9, and then she went to 1.6. So both her thyroid antibodies for thyroid peroxidase and thyroid binding globulin, those are things that, that tell us about thyroid function, are being attacked by her own immune system. And given that she is on medication and upped her dose, you would think because her TSH got better, that she is improving. However, her antibodies got worse. The problem with that is A, she was never told she had Hashimoto's, an autoimmune disease, and B, she was just only put on medication, and C, typically they won't even measure the thyroid antibodies. They'll only care about seeing if your TSH levels are in range. Thus, you still feel crappy even though your thyroid tests are somewhat normal, your antibodies aren't normal. So that's a big learning lesson because they won't look at your antibodies, and when you have an immune-based problem and your thyroid is being attacked by your immune system, we got to get to the cause of her immune system problem. And one of the main causes is her glucose level. So she needs to not only remove certain grains that she's reacting to, we need to test to find out what grains they are, because if she's not reacting to oats or quinoa or dairy, she can eat it, but if she is, that's causing further inflammation in her gut and causing her antibodies to be elevated. The other thing that we need to look at is potential hormonal influences. So her periods are irregular, she gets hot and cold flashes, she's still menstruating, and that's interesting that a 55-year-old female, I see a lot of Hashimoto patients that lose their period at about 36, 37. So, however, she is having some cortisol problems, and we need to do a Dutch test or a hormone test to find out how her circadian rhythm and her stress mechanisms are impacting her dysregulated female hormone cycle. So anyways, I know that's a mouthful, but I hope a light bulb went off on the top of your head and said, hey, why aren't they doing that for me? Why aren't they testing my thyroid antibodies? Have I ever been told I have a thyroid antibody and that I'm Hashimoto's even though I'm taking Synthroid or Armor? And when I up my medication, why does it not necessarily make me feel better even though my thyroid TSH levels may be within normal range or close to normal range? And then lastly, finding out what foods are reacting and how your hormones are impacting. I also made a recommendation for genetic test because just the fact that she has thyroid antibodies means that she has some genetic weak links that she's inherited that have expressed themselves, and we need to learn how we can bypass these weak links with nutritional protocols. So anyways, I'm offering a $99 special for 2 visits for me to go over your particular case review. If you want to take advantage of that special, we have that for the first week of August, between August 1st and August 8th. Give me a call at 561-883-0090 and let David, Sydney, or Diane know that you saw my video, that you want to have your own case study, or we don't have to necessarily do it over the internet. I asked this patient if I could share with my viewers her information without naming her name so that we can help you guys get a little more information on what's going on with your health as well. And so in order to help this patient, we need to help her immune system, and that in turn will reduce inflammation, that will give her more energy, that will give her more brain clarity, that will remove the gut disturbances, and that will help her hair regrow. So again, give me a call, 561-883-0090, and I look forward to helping you in your thyroid recovery problem as well. Thank you so much.